Assalamu alaikum and Bismillah Rahman Rahim. As the presentation is very important, so I have made another video on the presentation. In the presentation we have missed a few points. Here we will complete these points. So a few points more to be important in presentation. First, make an eye-to-eye contact with the examiner. It will give a very good impression. And also give a look to the second examiner who is also sitting. So don't ignore him. Give him a look on and off. So it will impress the other examiner as well, and you will take both examiner with yourself. So the other examiner, when his turn comes, he will have a very good rapport with you. Don't look at the patient while presenting the case, both in long case and short case. It's a very important point. We don't know, and that we are doing these mistakes again and again. We give a look to the patient on and off, and sometimes we are not aware even of that, but it tells the examiner that we have flaws. So try to make and try to practice that, not to look at the patient. Also make templates for the history. The history templates are also very important. Now the patient is not present here, but even now I can present a case to you. For example, my patient XYZ is a female of 40 years. She is diabetic and hypertensive for the last 10 years, presented with shortness of breath for the last 1 week. The shortness of breath was acute in onset, and it is more at the morning, and it is aggravated with exercise and fumes, and it is relieved with the data of taking inhalers. It is associated with cough. It is progressive, and it is morning in the morning time, and it is seasonal as well, and it is associated with the cough, which is also for the last 1 week. And the cough is productive in nature, and she is producing a sputum about 2 teaspoonful, and this is yellow in color, and it has no blood in it. It is not foul smelling. So these patients' complaints are associated. Now here we will present a systemic review. These complaints are not associated with any headache, blurring of vision, oral ulcers, thyroid problem, joint pain, jaundice, frothy urine, blood in the urine, no history of any loose motions, although she has lost 3 kg weight in the last 5 months. Past medical history reveals that she has taken ATT for the last 8 months, and she has a complete record from that of tuberculosis, and she has taken the complete course, and there was no side effects for these medications. She does not have taken any Hakimi medications. The patient is diabetic for the last 10 years, and she is taking metformin for that, and glimepiride 1 milligram, and she is compliant to the medications. She is also taking hypertensive medications, mostly lisinopril 10 milligram daily. The patient does not have any history of smoking. There is no history of travel abroad. There is no surgical issues, and her husband is poor, and he cannot afford the treatment. His income is less than that of 20,000 per month. Like this you can present history. So we can say that we have completed history almost in 2 minutes. So the more you practice, the more on these templates, the more they go into the reflexes, and the more they go into the spinal level, the lesser time it takes during the presentation. Make both templates in the short case examination and for that of history. The more you polish your history, the more it will impress the examiner. And also another point, don't do any hesitation in the history. It will waste your time, and gives a very bad impression on the examiner. Also note that the more polished your history is, it will cover most of your mistakes, and the most of your mistakes will be covered under the umbrella of good presentation. You can defend mostly when you are in a very strong position, and you are having a very good presentation, so it will cover your mistakes. Another very important point is never do the repetition of the same sentence again and again during the presentation. It will prolong your presentation. and will waste your time and will have a very bad impression on the examiner. At the end, I will say that kindly give at least 5 minutes during your busy FCPS preparation for understanding the Quran. There is a channel on YouTube with the name of Understand Quran and Salah. Quran has changed my life, and Quran will change your life as well, inshallah. So just only 5 minutes, and Allah will change your life. Thank you.